Dear students, welcome back. In the previous session, we have discussed about metatarsophalangeal function, in that metatarsal break and also hammer toe deformity. Now in this session, we are going to discuss about the remaining functions of the metatarsophalangeal joint, that is flexion, abduction and adduction, and also we can find some deformity called as Hallux valgus associated with metatarsal varus. Okay, yes. Now we will see the flexion range of motion at the metatarsophalangeal joints can occur to a limited degree from neutral position, but has relatively little purpose in weight bearing foot other than when the supporting terrain drops away distal to the metatarsal heads. That means here the flexion range of motion is very limited degree from the neutral position, and also it is having a very little purpose in weight bearing foot except in the supporting terrain. That means there is an uneven surfaces, then this flexion range will have some extra range of motion. And then most metatarsophalangeal flexion occurs as a return to neutral position from extension. So how can we show, how can we see this flexion? Means whenever the extension at the metatarsophalangeal joints occurred and again it comes back to its neutral position. For example, here you can see, so for example, this is the neutral position and this is the extension of the metatarsal, and then again it comes back to the neutral position. Then this, we can see this one as the flexion of the metatarsophalangeal joint. Okay. However, toe flexor musculature is quite important, and it should be distinguished from the functionally less relevant metatarsophalangeal flexion range of motion. Okay, and here we can see the abduction and adduction of the metatarsophalangeal joint appear to be helpful in absorbing some of the forces that would be imposed on the toes by the metatarsals as they move in pronation as well as the supination twist. Okay. The first toe normally adducted on the normally the first toe adducted on the first metatarsal. Okay, about 15 to 19 degrees. That one is normal one. For example, an increase in the normal valgus angle. An increase in the normal valgus angle greater than this 19 degrees. Okay, normal valgus angulation of the first metatarsophalangeal joint is referred to as, so here the medial angulation of the hallux, that is the great toe, is increased, then such condition is called as hallux valgus. Hallux valgus, and normally it is associated with a varus angulation. Normally it is associated with varus angulation of the first metatarsal at the tarsometatarsal joint. At the tarsometatarsal joint, here we can find the tarsometatarsal joint angulation. So then it is known as metatarsus varus. So normally excessive bone growth at the head of the first metatarsal is due to abnormal pressures from the malalignment we can see. Okay, so this abnormal angulation, that is medial angulation of the first metatarsophalangeal joint, is referred as hallux valgus and may be associated with varus angulation of the first metatarsal at the tarso-metatarsal joint known as metatarsus varus. Okay, so this is about the metatarsophalangeal flexion, abduction and adduction. In the next session we are going to discuss about interphalangeal joints. Thank you.